Well, good evening and welcome everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckville and I will be serving as your program facilitator and will present your questions to our panel of experts. We'll talk to Jefferson Health weight loss specialists as they explore the benefits of bariatric surgery, such as eliminating diabetes and improving fertility, as well as how revision surgery and weight loss medications work. Well, thank you so much for submitting your questions in advance. And the questions that you'll hear me asking the providers are all submitted right from when you registered for this webinar. And if you have any questions throughout our discussion tonight, for those joining us on your computer or tablet, at the bottom of your screen, you should see an icon that says Q&A. We'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And due to hospital guidelines and privacy, we are unable to comment on specific cases. Well, with that, I want to go ahead and introduce our experts for the evening, starting with Dr. Mark Neff with bariatric surgery and Dr. Nathan Lent with bariatric and metabolic medicine. Well, thank you both so much for joining us, and I will give each of you a minute or two to just say hello and provide a little background information about yourself. So Dr. Neff, let's go ahead and start with you. How are you doing this evening? Oh, and I think you're on mute.
Oh, you'd think after 4 years of the pandemic, you'd figure it out.
You got it.
Sarah, I appreciate the introduction. I'm Mark Neff. I'm the director for the surgery program here at Jefferson Health, New Jersey. I'm a board certified general surgeon. I'm fellowship trained in minimally invasive surgery, certified by the Board of Obesity Medicine. I'm a diehard Eagles fan and very sad these days. I'm a diehard Phillies fan and very happy these days. I've been doing weight loss surgery in some way, shape, or form since 1999. I was recruited here in 2005, and after 2 years of planning, we did our first case in January of 2007, and now we're close to 5,800 cases here at Jefferson Health of New Jersey. Very pleased and honored to be part of this night's webinar.
Well, thank you so much, and we're thrilled to have you. All right. Well, Dr. Lent, how are you doing this evening?
I'm doing well, Sarah. Thank you for the introduction. Thank you for the invitation here. Tell you a little bit about myself. I am board certified in what we call obesity medicine and in family medicine. And I spend part of my time doing family medicine, primary care, and part of my time doing weight management, or what we call obesity medicine. I'm got board certified in what we call weight management in 2019. And I've been practicing, been very lucky to practice as part of Jefferson's comprehensive weight management program since about 2021.
Amazing. Well, thank you so much both for joining us. And without further ado, I think we should dive into the questions because I know we received a ton. So thank you to the audience members for submitting. All right, well, let's go ahead and kick it off with question number one. Dr. Neff, this one is for you. What are the requirements to qualify for weight loss surgery, and are there age limits?
So the requirements to qualify for weight loss surgery have some variation per insurance company, but statistically speaking, we're talking about a calculation called your body mass index, a calculation based on your height and weight that's over 40, which basically translates to 100 pounds over your ideal body weight, or a body mass index over 35, which basically translates to 80 pounds over your ideal body weight with a specific serious medical condition related to obesity, such as heart disease, diabetes, or refractory high blood pressure, severe sleep apnea. These don't necessarily reflect on specific age limits. We do have an age limit at our hospital of 18 to 75. But there are places in our region where you can get surgery done if you're younger than 18.
Okay. All right. Well, thank you. Okay, moving along to our next question here. Dr. Lent, along those lines, what are the requirements for weight loss medications and are there age limits?
Great question. There's always some wiggle room. These are guidelines. These are not laws. And as Dr. Neff mentioned, BMI or body mass index is something, we use all throughout medicine. We use it as well. We have to acknowledge that body mass index is not a perfect indicator of health or even of body weight, but we do rely on it. So short answer is if someone has a body mass index of 27 to 30 or 27 to 29.9 with some sort of life-threatening comorbidity, life-threatening medical condition associated with excess body weight, they are a candidate for weight loss medicine. And pretty much anybody with a body mass index of 30 or greater also qualified for a weight loss medicine. Of course, it all depends. It's not an easy blanket decision, but those are the good guidelines. And there are some weight loss medications that are approved in children. So there are some, and throughout today, you might, or throughout your study of weight loss, there are some diabetes medicines that also work for weight loss. I'm not really going to talk about those. I'm going to talk about the medications that are FDA approved for weight loss. 12 years and up, we have several weight loss medications that are FDA approved for adolescents, age 12 and up, and then a couple that are approved for 17 or 18 and up.
Okay. Yeah, interesting to hear. And let's continue this medication conversation. Do we know the long-term side effects of medicine like Ozempic and Wegovy? And can you just tell us exactly how do these medications work?
Sure. Well, there's no well-documented long-term side effects of any of the weight loss medications, but there are some potential short-term side effects or medium-term side effects. So it depends a little bit on what medication you're talking about, but most of the time lately, we're talking about a class of medication called GLP-1 receptor agonists, or what most people call GLP-1. They can increase the risk of, we think, they can increase the risk of pancreatitis, cholecystitis, small bowel obstruction very slightly. These are rare complications, but the risk is slightly increased. Beyond that, there's a mild to moderate chance of nausea, heartburn, indigestion, diarrhea, constipation. So there are some patients who have these long-term side effects, but typically if someone's having significant side effects, we either change the medicine or stop it. Now, how do these things work? That's we know. Actually, there's a lot of medicines out there. We don't know how they work. These ones we know, and fortunately, it's really, they're positive. It's positive. These have really good effects in the human body. Again, they're not perfect. They can have side effects, but if we're just talking about weight loss and we're ignoring diabetes for a second, then the effects we see are that they slow down the rate at which food flows out of the stomach and into the rest of the GI tract. So delayed gastric emptying, which makes people feel full faster. So you can feel full after eating less food than usual. So that's a really important effect. And probably more importantly, it acts on the part of the brain that controls hunger. And it tells our brain we're full. The natural half-life of this hormone, GLP-1, in the human body is about 3 minutes. The half-life of these medicines is a week. So this is a mechanism that exists in our body already, and some brilliant people figured out how to, capitalize on that with these medications.
Absolutely. Really incredible science. So along those same lines, what are the pros and cons of the different weight loss medications that are being advertised currently?
The pros are they are pretty safe. I mentioned the potential risks. No medication is without risks, so there are these potential risks. But really a pro is that they don't tend to cause side effects. About 95% of people don't have significant side effects. So that's a pro. They work pretty darn well. The average weight loss, depending on which agent you're talking about, is 15% or 20%. So pretty effective. And I've been doing weight management long enough to know that, I did it before we had these medications. There was nothing this effective except for bariatric surgery. And by the way, bariatric surgery is still more effective than the medications, but these medicines do work. That's a pro. And a con is they're really expensive. Most of these medicines, the full market price is $1,600 or $1,200 to $1,600 a month. And so insurance coverage is intermittent. There are many people, unfortunately, who just their insurance doesn't cover the medication, and it's so expensive. It may not be an option for most of us if our insurance doesn't cover it. Another potential con, it doesn't work for everybody. So it's an injection. A lot of people really don't like injections. So for someone who's needle phobic, that's something we need to consider. And so the medication may not be for the people who are very afraid of needles.
Okay, some important considerations there. And finally, I guess one last question related to the medications here. What should one do when weight stalls while on this weight loss medication?
You should talk to the person who's prescribing the medication. Work with your provider, physician, PA, nurse practitioner, whoever you're working with. These medicines do not work in a vacuum, really, at least not long term. So what you want to do is develop, whether it's with your primary care provider, or with somebody like me, or even with Dr. Neff or a bariatric surgeon, come up with some sort of plan that's comprehensive. And so if you do stall, there's almost always something we can do. There's something we can change. There are many other things we talk about in weight management other than medications. So I think that'd be a good way to answer that.
Yeah, absolutely. Okay, thank you. All right, Dr. Neff, turning back to you now. Can you discuss the differences between gastric bypass and gastric sleeve surgeries?
Yes, Sarah, thank you. So the gastric bypass is an operation that dates back to 1965. It's been done through small incisions since 1994. In many ways, this is the Cadillac of weight loss surgeries. It has the most data behind it. It's been around the longest, and it takes the approach that there's something wrong with the stomach. And what we'll do in the operating room is we'll reroute the flow of food. And by doing that, we change how quickly you eat, how much you eat, the types of foods that you eat, and we change your metabolic response to the foods that you eat. The sleeve takes a slightly different approach. It was first done in 1999 at Mount Sinai in New York by a gentleman by name of Dr. Michel Gagne. I mention his name because I'm his surgical grandchild. He trained a surgeon by name of Dr. Val Andre, and Dr. Val Andre trained me. So just putting in a little shameless plug if I can. And the sleeve takes the same approach. There's something wrong with the stomach, but instead of rerouting the flow of food, which is a little bit more complicated, we'll just remove the portion of the stomach that's not working properly. Similarly, changing how quickly you eat, how much you eat, types of foods that you eat, and your metabolic response to food, but not changing the actual pathway of the food and not being as risky as the operation called the bypass.
Okay. And can you dive in a little bit more about the pros and cons of each surgery? And is there significant recovery time with both?
Pros and cons and recovery time. Sure, I can. So I like to think of the bypass as the Cadillac and the sleeve as like the hybrid, using a car analogy. So the bypass, the Cadillac of weight loss surgery, it's been around the longest. It's what everything's compared to. And like a Cadillac, you have to put super unleaded into that car. And like a Cadillac, you have to bring it back to the dealership to get good mileage out of that vehicle. And if you damage that vehicle, it's very expensive to fix it. So in terms of the bypass, you can't really cheat on a bypass. You have to eat a very strict diet. And there are some long-term side effects in terms of risks of malabsorption of vitamins and nutrients because of the way we reroute the flow of food. So bypass, I like to describe to people as a stricter operation. It's also very good for people that have a sweet tooth because there's a side effect we call the dumping syndrome. If you eat the wrong food, you curl up in a ball and you curse Dr. Neff for doing this surgery on you. It's in no way dangerous, but it's a very uncomfortable, almost food poisoning sensation. The sleeve is a simpler operation to perform, so it's a shorter recovery time. It's a shorter stay in the hospital. It's a lower complication rate. But the sleeve, it is a little bit easier to cheat on. So I think of the sleeve as almost one of these new hybrid cars that's out that's getting really impressive gas mileage. You don't have to be as strict with the super unleaded that you put into it, but the sleeve does have a failure rate if you have something like a sweet tooth. So when I see patients in my office, one of the things I do is I tell patients, you have made the biggest step of just coming to seek some help from a medical provider. You don't have to choose the surgery right now. Let doctors like myself and Dr. Lent do our job and help guide you in terms of what medication might be right for you or what surgery might be right for you. Let us help educate you. And I'm very, very strict about not telling patients which surgery you have to have done. I really like the patients to come to me and tell me they've read about the surgeries, they've learned about the surgeries, they've studied the surgeries, they've asked us the questions about the surgeries, and they tell me what they want done.
Absolutely. Okay. Thank you. Very helpful there. All right. Dr. Len, I think we may have discussed this earlier, but if you could just dive in here for a second. For medical intervention, can you talk about the certain weight or BMI that a person might have to be able to be considered?
Sure, yeah, the generally accepted guideline is a body mass index of 27 or 27 to 29.9 with a life-threatening comorbidity. Examples are like high blood pressure and diabetes and sleep apnea. Those would be considered candidates for weight loss medicine, and then any patient with a body mass index of 30.0 or greater, even without a life-threatening comorbidity.
Okay. Thank you. And then Dr. Neff, can you just clarify again for surgical intervention what that would be?
I apologize. I was typing an answer to an audience member.
Oh, thank you.
One of
Multitasking. No, it's great. Just if you could clarify again the certain weight or BMI that you would have to have in order to be considered for surgical intervention.
So currently, this is slightly different for different insurance companies. Broad acceptance is a body mass index over 40, 100 pounds over your ideal body weight. Broad acceptance is a body mass index 35 to 39.9 with a serious medical comorbidity related to obesity. But there are certain insurance companies that are now recognizing a body mass index 30 to 35 with something like diabetes, something that we've learned these surgeries are very, very effective in treating.
Got it. Okay, thank you for clarifying. And then just a note too, feel free for the audience member to keep submitting your live questions because we will also answer them at the end once we get through our submitted questions. But for now, Dr. Neff, turning back to you, just to talk a little bit about revision surgery. Can this surgery be done again if someone has hit a weight loss plateau or would like a revision after a certain number of years?
So the weight loss plateau, that's a difficult thing to discuss. A lot of reasons why people can hit a weight loss plateau. They may be somebody who stopped exercising for a whole variety of reasons, maybe an injury, maybe a change in lifestyle, change in a job, living situation. They may be somebody who's no longer following a diet for one reason or another, change in economics, geography. Maybe they've been put on a medication that promoted some weight gain. Maybe they had a change in life or circumstance, pregnancy, divorce, change in living situation. So my roundabout way of answering your question, Sarah, is that we can redo these surgeries, but they're not solutions to stressors in life. When we approach a person who we're discussing a possible revision, and currently the revision rates are around 20% for a sleeve and somewhere around 10 to 15% for a bypass. When we discuss these revisions, we really look at, well, what didn't work the first time around? And we're really trying to get at that because if we don't address why the surgery didn't work the first time, we're not going to be able to fix it in the operating room.
Absolutely. Okay, thank you. All right, Dr. Lent, do patients take medication forever to maintain weight loss? And what happens when patients end the medication? I know this was a big question from audience members.
Yeah, that's a great question. And to be honest, a lot of us are still waiting to find out. Well, we have studies kind of on both ends of the spectrum to guide us right now. We have studies that show if someone stops the medication within 3 years of starting it, they're very likely to gain most of the weight back. And there's a study that goes out 10 years that shows when people stop the medication, most of them did not gain most of the weight back. So we think it's probably somewhere between 3 and 10 years. We don't really know, and it may depend on the patient. And so when the medicines were first released, we kind of thought people would have to take it forever, but it seems like that may not be true. So can't give you an exact answer yet. We definitely try to tell patients before starting these medications to consider this a long-term intervention. And what we wouldn't want to do is put somebody on it for something less than a couple years and stop it when they get to their goal weight. That these medicines, they suppress appetite. And so if we stop the medicine, the appetite returns and the weight may come back.
Okay, very interesting. Thank you. All right, Dr. Neff, can someone with an autoimmune condition, PCOS or Hashimoto's, get weight loss surgery?
Yes, autoimmune conditions are very challenging for the weight loss surgeon because that can affect wound healing. So we do pay careful attention to what medications the patient is on. Patient on rheumatoid arthritis medications. Some of the injectables are actually very damaging to wound healing. So we look at what is the exact autoimmune process, what's the medication they're on. I have still done these surgeries in patients with these medications. We just try to time the surgery with the injectable anti-inflammatory medication. For PCOS, actually, these surgeries can be quite effective because many of the symptoms improve as those patients lose weight. In fact, one of the exciting things is the patient with PCOS who has had years and years of infertility, who after they have the surgery and lose their weight, they're finally able to achieve a pregnancy.
Okay, that's great. All right, thank you. Dr. Len, for someone beginning medications for the first time, what is the recommended time frame to see results? And I know you kind of mentioned this, but if you could dive a little bit more into that, that'd be great.
Of course, sure. Thank you for the question. We start these medications at low doses. And for some patients, they start to see appetite suppression and weight loss at low doses, but for most patients, they do not. So it typically takes at least several months to start to see significant weight loss. The 15% total body weight loss that we see averages in the study is a 12-month time frame. So we, what we'd like to say is if you lose weight quickly, then usually it comes back quickly. If you take your time and you lose weight the right way, it takes time and it's more likely to stay off. So patience is a virtue when it comes to weight management.
Okay. All right, great to know. Patience is a virtue. We'll keep that in mind. All right, we have about 2 more submitted questions here, and then we'll get to our live questions from the audience. But for now, Dr. Neff, turning back to you, are there any bariatric procedures that are reversible?
Difficult question, Sarah. So we don't tell patients that the bypass is reversible, but the truth is it is reversible. The sleeve is not considered reversible. Once I remove that portion of the stomach from the body, I can't put it back in. Now, just taking that one step further, in my experience, I could count on one hand the number of times I have reversed a bypass, and they never are patients who are completely back to normal. Something about cutting the stomach and still taking it apart again and reconnecting it, it's never exactly the same.
Okay. All right. Well, thank you. All right. And our final submitted question here, Dr. Len, are there medication options other than injections?
Yes, there are. Yeah, there are several. They don't tend to work as well as the injections, but if we're talking just the FDA approved options, there's Orlistat, which is actually available over the counter. I don't recommend it. Phentermine, Qsymia, and Contrave are the FDA approved pills. And they can be very effective and absolutely the right answer in some situations. There are some people who can't have the injections. So, your average primary care provider might not know about these. Pretty much everybody knows about the GLP-1s, but these other options, you might need to see someone like myself or Dr. Neff or a weight management person to get those.
Okay. All right. Well, with that, let's go ahead and dive into the live questions that we've been getting from the chat. So thank you to all who have submitted. I will kick us off with the first one, and whoever wants to chime in and answer, please feel free. So for the first question from our audience here, are there weight loss, weight management medications that do not have to be taken long-term or forever, but use perhaps short to medium to jumpstart weight loss?
Well, do you want to do it the right way or do you want to do it that way? So to be thorough, there are probably situations out there where that might be appropriate, but in general, no, we don't recommend that. For anything that works for weight loss, if you stop doing it, generally the weight comes back. So and our understanding of weight balance and energy balance in the human body has evolved such that we know that kind of approach doesn't work. Now, Phentermine is a medication that was FDA approved initially in the 60s. Its FDA approval still says it's only to be used for 12 weeks. So at one time, this was the prevailing thought that a medication could be used just to jumpstart weight loss, and then can be that really doesn't work. That the weight comes back.
Okay. All right. Again, sounds like patience is a virtue. Okay, next one here, Dr. Lent, this one might be for you again. What are your thoughts on compound GLP-1 medication?
You know, I almost, I feel bad saying this, but I don't recommend it. I don't recommend compounded GLP-1s. The FDA doesn't recommends against compounded GLP-1s. The manufacturers recommend against compounded GLP-1s. So I am not alone when I recommend you avoid the compounded GLP-1s. The reason I feel bad about that is because they're available and they're a little cheaper than the branded stuff. Unfortunately, we can't prove that they're safe, and we can't prove that they're effective. Now, in my clinical experience is they do seem to be effective. We just don't know if they're safe. And so I definitely fall in line with the FDA that I don't recommend using that. They're such an attractive option, but boy, I would really resist it.
Okay, thank you. All right, next question here. Can weight loss medications be taken after bariatric surgery? I feel like this is a twofold question for both of you there.
So if I can jump in and answer this first, I apologize, Dr. Lent. This is actually one of my favorite questions, and we're currently using these medications in a similar fashion. I think that we have a number of tools in our toolbox to help patients who are overweight. We have diets, we have counseling, we have medications, we have endoscopic maneuvers, we have surgeries. And I think that the fully integrated program, which you get when you come to Jefferson, helps guide you through all of these different options, helps give you the tools that are right for you. I think that we're going to evolve into a specialty, very much like a cancer program, where you come to a cancer specialist, you get a multidisciplinary program, and you get navigators, and you get dietitians, and you get social workers, and you get physicians specializing in chemotherapy, and you get physicians specializing in cancer surgery. I think we are in the infancy of that with weight loss medicine, that we're approaching things the same way, a multidisciplinary approach with dietitians and navigators and behavioral counselors. And now we have medications. And I believe that that's where we're headed, is a patient who may need medication before surgery, they may need medication after surgery, maybe it's right after the surgery, maybe it's delayed, maybe it's choosing different medications based on a variety of patient factors. There are even some early suggestions that we start doing genetic testing on patients and understand their specific type of obesity. I think that's the direction that obesity medicine is evolving into, is this multidisciplinary approach.
Really exciting to hear. And anything that you want to add on, Dr. Lent?
Yeah, I agree with Dr. Neff. It's a great vision, and I think that we, as the bariatric surgery teams and the non-operative weight management teams, we already really work together all the time. It's may not be formalized yet, but one great thing about the Jefferson Comprehensive Weight Management Program is that it is comprehensive, and bariatric surgery and non-operative weight management, like myself, we're under the same umbrella. We work together. I will put in a caveat that in the weight loss phase after bariatric surgery, so while somebody's still losing weight, we don't recommend a medication. But after that early weight loss phase, right after the surgery, if someone starts to regain weight, then we're ready to jump in. And we are often referring patients back and forth. We have patients who don't respond to medications get referred to bariatric surgery. Patients who've had bariatric surgery that start to regain weight come back to us. So yes, we absolutely use weight loss medicines in patients before and after bariatric surgery.
All right. Well, thank you both. Okay, next question here. Could a gastric sleeve cause you to lose too much weight?
So we generally think of patients who have malabsorptive procedures like the bypass as people who can overshoot. I have seen this in sleeve patients too, but that's typically in a patient who's really struggling to adhere to a diet plan, and a person who's really struggling to adhere to the vitamins and supplements we recommend. And typically it's in a person who is not following up with the healthcare team. We're very aggressive about our education before the operative procedures, with typically 3 months of education, and we're very aggressive with a follow-up after these surgical procedures, with roughly 12 visits that first year between the surgeon, the dietitian, and the nursing practitioner. So, a person who overshoots with a sleeve is typically somebody who's really struggling because they're doing it all on their own.
Okay. All right. A follow-up question for you, Dr. Neff. Is the lap band still available?
That is so funny. I was just starting to answer that question, typing in the background.
There you go.
So I think that we've learned a lot about these surgeries as time has gone by. The truth is that there are actually more than a dozen procedures worldwide that are helpful for people who are interested to lose weight. The most popular ones right now in our country are the sleeve and the bypass. But if you turn back the clock about 10 years, the band was very popular in the early 2000s, I guess 15 years. And it was because not everybody was interested in getting the bypass and they wanted another option. And the band was very attractive to people because there was no permanent cutting of the stomach, because it was adjustable, because it was reversible. And there was nearly 50% of the surgeries being performed in 2009. And what happened is in 2010, the sleeve was approved, and now there was another option. And by that point, after about 250,000 bands were put in across our country, we started to see some long-term results. And the bands were very slow in weight loss. The bands were very annoying for patients to have to keep coming back to the physician to have fluid put in or fluid removed. And we were starting to now see complications from the band. And it turned out that the longer that you had the band in your body, the higher the risk you were going to have a complication from this device. It is still being performed in our country, but very, very few patients are getting it done. We haven't actually performed one at our hospital here in New Jersey since before the pandemic.
Okay. All right. Well, thank you so much for detailing that for us. All right. Next question here. Can you lower the dose of GLP-1s after you reach a healthy BMI? Oh, I think you might be on mute, Dr. Len. There you go.
Got me too, Dr. Neff. So I'll take that one. Yes, absolutely. It is possible to lose too much weight with medicines. And remember, not all weight loss is good weight loss. So we're looking for healthy weight loss. And there are times when the medication, quote, works too well, meaning it suppresses the appetite too much. And we even in the active weight loss phase, sometimes we have to decrease the dose, but certainly once somebody reaches their goal weight or what we think is a healthy weight, if they're still losing, we will absolutely decrease the medication dose. And sometimes we decrease, they're still losing weight and we have to stop it. So it's not common, but it can happen.
Okay. Thank you. All right, Dr. Neff, question for you here. How long is the process between the initial evaluation and surgery? Could that timeline be reduced if you tried and failed to lose weight using medication?
So it's very helpful to have documentation of prior attempts at weight loss. That is wonderful if you have doctor's notes, if you have receipts, if you have history, if you have Weight Watchers, these are all very helpful. But the insurance companies, for the most part, require you to go through a specific period of time before you get into the operating room. It varies depending on the insurance company, but in our area, most insurance companies are around 3 months of a preoperative program before you can get to the operating room. There are some that are 6. So specifically to answer your question, Sarah, when I see a patient in my office this week, they're probably not getting surgery done until January.
Okay. All right. Thank you for detailing that for us. That's helpful. Okay, next question here, Dr. Lent, I think this one is for you. If you had side effects like stomach upset and diarrhea with metformin, could you have the same side effects with a GLP-1 injection?
And I think they're referring to metformin.
Yes. Yep.
Short
Correct.
answer, yes. The slightly longer answer, the medicines, the GLP-1s and the metformin, they work by 2 totally separate mechanisms. So it's kind of unrelated. You could take metformin, never have a side effect, and take a GLP-1 and have horrendous side effects. Or you could take metformin, have horrendous side effects, take a GLP-1 and have none. So it's neither is really predictive of the other.
Okay. All right. Thank you. Question for you, Dr. Neff. Do you know if bariatric surgery is covered by Medicare and Medicaid?
Yes, it is. So you do have to go through some specific hoops for a Medicaid approval, Horizon New Jersey Health. And it's actually quite favorable in terms of the insurance approval, as long as you jump through those hoops. For Medicare, there isn't a specific approval process, but you do have to have the appropriate I's dotted and T's crossed, so to speak, to get Medicare to cover it.
Okay. All right. Thank you. Okay. Next question here. This person is wondering, as you enter your 60s and your metabolism slows down, should you even worry if you gain weight? And whoever wants to jump in to answer this one.
I'll jump. I always jump first and then look later. So metabolism does change as we get older, but that doesn't mean that the weight that you gain isn't something that should be something you pay attention to. The weight that you gain affects a variety of health conditions. We've linked 65 different medical conditions to being overweight. We've linked 15 different cancers to obesity. So I think that if you're looking to live to a long, happy life into your 80s or beyond that, it is important to pay attention to your weight.
Okay. Thank you. Anything to add, Dr. Len?
I agree. I'd say the life expectancy in America of someone who takes care of themselves, who doesn't smoke, doesn't drink, takes their medicines if they need to, that the life expectancy is about 91. So if you're in your 60s, you're only 2/3 of the way there. So take care of yourself. If you're, follow up with your primary care doctors. If you're starting to have complications like high blood pressure and high blood sugar and cholesterol, absolutely, get it taken care of. Try to lose weight, try to do it in a healthy way, of course. Medicines are, safe in people in their 60s. And by the way, you don't have to take medicines to lose weight. We haven't talked much about healthy eating, and really the goal of the medicines, they suppress appetite so it's easier to eat healthy. Most important thing is that we all eat healthy, healthful diets and get, exercise doesn't really work for weight loss, but it is good for us. So yes, absolutely. Don't throw in the towel when you hit 60. Keep fighting, keep trying to take care of yourself. You may have a lot of time left.
Absolutely. I think that's a really helpful reminder here as we're talking about surgeries and medications. So thank you for bringing that up as well. Okay. Next question here is about pregnancy. This person's wondering, how fast after delivering a baby could I do surgery?
I was just typing an answer to that one. I
Mind.
I think that I think one of the key factors there is, how much support do you have in your world? It would be hard to take care of a newborn having had a fresh surgery. I think another important aspect is, are you breastfeeding? You'd have to pump and dump, or there'd be some anesthesia or some of the medications that would make their way into the breast milk. Um, but I would say, as quickly as 6 weeks would be, my specific number that I would offer a patient if they had gone through everything else and they had gotten their insurance approval and they wanted to go full steam ahead. They had a supportive family, friends, loved ones. I would say 6 weeks.
Okay, great to know. A follow-up question for you, Dr. Neff. Is the gastric balloon still available?
Well, so the gastric balloon is a very interesting device. Yes, it is still available and it has undergone some evolution. But one of the things about the gastric balloon is that it's not approved for by any insurance company. So that's paying out of pocket to have it put into position, and it's paying out of pocket to have it removed. And then if you have a complication from the gastric balloon, you may very well have to pay out of pocket to treat the complication. And then furthermore, the gastric balloon, which is really more popular in Europe than in the United States, is really designed as a short-term solution for only a couple months. So in the countries across the ocean, they use it as the marriage procedure, meaning you get it placed when you get engaged, you lose the weight for your wedding, and then you have it removed right before your wedding so you can enjoy your honeymoon.
Interesting.
It's
All
it's
right.
a there is a provider at Jefferson Center City who does do the gastric balloon. And if a person was interested, we could certainly steer them to that provider, but it really is a very short-term solution. That's a person who could certainly work with Dr. Lent or one of his colleagues on some medication as well.
Okay, thank you. All right, next question here, Dr. Lent, this is for you. And apologies if I mispronounce this medication here, but if you do not recommend phentermine, what are other medications, especially if you are borderline diabetic?
Well, I often do recommend phentermine. Definitely good in the right scenario, in the right setting. Phentermine is inexpensive and it's tried and true. So we don't use it like the FDA approval suggests. So we don't use it as a short-term medication. We use it off-label as a long-term medication. For many of our patients, the patients who don't have insurance coverage for one of the injections or one of the other medications, phentermine may be their only option. So we use that a lot. And then forgive me, sorry, you said the second part of that question was diabetes?
Yes, this person is just saying, especially if you are borderline diabetic.
Ah, okay. If you're borderline diabetic, that probably refers to a state most of us will call pre-diabetes. Honestly, we manage pre-diabetes the same way we manage everybody else when it comes to, weight management. And part of our goal with weight management in someone who has elevated blood sugar is to prevent the development of type 2 diabetes. So we, the same medicines we would use for weight loss in someone with normal blood sugar, we would use for someone with pre-diabetes. Typically, there are no FDA approved medications for pre-diabetes, and actually pre-diabetes in and of itself doesn't necessarily need medication.
Okay. All right, thank you. Okay, next question here is a great question. So thank you for submitting this because we've been talking about GLP-1s, but this person would like to know exactly what they are. So if you could just repeat again, what is exactly a GLP-1? I think that would be very helpful.
Sure. Yeah. I mean, that's a good point. I talk about it all day, every day. I forget, that I need to explain it sometimes. So GLP-1 glucagon-like peptide type 1 is a hormone that our body makes. It's a hormone of satiety, meaning when the level of that hormone goes up, we feel full. And a GLP, the medication is called a GLP-1 receptor agonist, meaning it does the same thing that the natural GLP-1 does in our body. So it stimulates the same receptors throughout our body. So, and the effects I mentioned earlier about promoting satiety by delaying gastric emptying and stimulating the hunger center in our brain in such a way that it the medicine tells us we're full even if we're kind of not full. That's what GLP-1, the natural GLP-1 does. Same thing.
Okay. All right, thank you. Okay, Dr. Neff, turning back to you here with a few questions. Interesting question here. What surgical procedure do you perform the most?
So currently about 2-to-1 sleeves to bypasses. But that varies year to year, but that's sort of the standard across our country right now is sleeves to bypasses about 2-to-1. I don't particularly have a favorite. Lifetime numbers about equal. And those can be provided by my office manager if anybody is interested. I'm somewhere around 2,000 procedures lifetime.
All right. Very impressive. Thank you. Next question here. How do you treat excess skin after weight loss? Good question.
So everybody gets different amounts of excess skin. It depends on where they're starting from, how much weight they lose, their age, their race. Damage from sun exposure can damage the collagen underneath of the skin, and the type of exercise they do after surgery. All that being said, statistically, about 10% of patients who undergo weight loss surgery do pursue removal of excess skin. Primarily, we're talking about skin in the lower belly area, but it's also a skin that can be located on the inner thighs or underneath of the breast tissue. I'm sorry, not underneath, but the breast tissue. But skin underneath of the neck or on the back of the arms, that's typically not covered by any insurance company.
Okay. And a follow-up question here. What are the chances of scar tissue when having bariatric surgery? And what issues can that cause?
We heal from all surgical procedures through forming scar tissue. Everybody forms different amounts of scar tissue. The amount of scar tissue that we form with open surgeries is more than with laparoscopic or robotic surgeries. And the amount of scar tissue that we form from bypass surgeries is more than that from sleeve surgeries. The specific issues we worry about with scar tissue is something called a small bowel obstruction. The incidence of that after a bariatric procedure is about a 1 or a 2% chance lifetime.
Okay. All right. Thank you. Okay. And for our final live question this evening, and then I'll ask a question that I have for both of you. But this person is wondering what percentage of weight loss is maintained after 10 years? If you have a rough idea, it would be interesting to know.
Related specifically to the surgery or medications?
I think we could, cover both.
So the 10-year data after these surgeries, it depends on a couple of factors, and then I'll answer the question. It depends on your age, it depends on your race, it depends on where you're starting from, it depends on how much weight you lose. It does depend also on the type of surgery you have done. And some of those other things that I mentioned in the beginning, losing job and pregnancy and change in living situation and change in job. So all those things take into account. There's about a 10 to 15% weight regain long-term from where you end up. So you lose 100 pounds, typically about 10 to 15 pounds weight regain over that period of time. But I would add one really important factor there, which I don't think gets talked about enough, which is we lose track of a lot of people who have this surgery done. So the real statistics we have to scratch our heads about, because none of us have 100% follow-up on patients who do this surgery. That 10 to 15% is patients who keep coming back to me, and I can keep helping them when they have some weight regain, or I can steer them towards somebody like Dr. Lent if they need some medication. I think, to be honest, the rates are probably much, much higher in patients who get the surgery done and say, thank you, Dr. Neff, and I never see them again.
Yeah, absolutely. That's a good point. Okay, and Dr. Len, anything to add? I know that obviously weight loss medications are a little bit newer, so probably a tougher question to answer there.
Yeah, it really is. We have just one weight loss medicine, one GLP-1 called Saxenda that actually has been FDA approved for almost 10 years. It's a once daily injection. So, not too long ago, it was like the best thing and nobody wanted it. Right now, everybody wants a GLP-1 because it's once a week, but when it was once a day, nobody wanted it. But we do have some data for Saxenda. It's slightly less effective than the more modern kind of GLP-1s. So this is like a first generation GLP-1. The average weight loss with that over the 10-year period is about 10%. Now with the newer GLP-1s, the average weight loss in 1 year is 15%, and beyond that, if someone stays on the medicine and follows a comprehensive weight management plan, then it goes up to about 20%. And that we have those data out to, I think we're at about 5 years now. We expected it probably be, it probably won't stay that good forever. We really don't know though, So when I find out, maybe I can do another webinar and I'll tell you that.
Absolutely, we'll check in. Sounds great. Okay, well, thank you both. And I think that wraps up our live questions for the evening. So I'll go ahead and ask my final question as we wrap up for tonight. So for the final question this evening, what are your goals for everyone listening in on this webinar? What would you like our viewers to take away from tonight? Dr. Neff, we'll go ahead and start with you.
My goal would be to help patients start the conversation with their healthcare professionals about obesity management. We have so many tools at our disposal. We know so much about how to help people struggling with obesity. It's the final common pathway to treat so many different disease processes. We currently in our country, we only service about 1% of the people who could benefit from surgery. And I think the statistics, Dr. Lent can correct me, are somewhere around 4 or 5% of the people who could benefit from a medication. There's so many people that could be helped by approaching a healthcare professional at Jefferson about my weight.
Absolutely. Thank you so much. All right. And Dr. Lent, how about you? Any last final remarks for this evening?
Yes. Well, I hope, thank you everybody for joining us. And, I hope you can take away from this that we talked a lot about medicines and surgery. Honestly, healthy eating, healthy lifestyle, exercise, good sleep, managing stress. These are the things we really hope to achieve and have been shown, in addition to medications and surgery in the right settings, to help people achieve a good body weight, a healthier body weight. So you want to come up with a comprehensive plan. And a lot of primaries are becoming pretty savvy with these medications and these other options. So I would lean on your primary care provider. The other thing is please consider bariatric surgery if you're one of those people who meet criteria. That there's a lot of understandable, I guess, hesitance regarding bariatric surgery. But like Dr. Neff said, the bariatric surgery, it's only 1% of people get it. It literally saves lives. If you look at all the things we have available to us in medicine, bariatric surgery literally saves lives. So please consider bariatric surgery. Please remember, not everybody's insurance covers weight loss medicine. So you don't know unless you could call your insurance company. It's typically an employer decision. So you can talk to your human resources department if you have insurance through your workplace and they don't cover weight loss medicine, talk to your HR representative. If they hear about it enough, you know, the people who make decisions at that company may change their mind. They may, you know, decide to start covering weight loss medication. And I guess the last thing would be, you know, we have a Jefferson, we have a good comprehensive weight management program. We work together. We're here for you.
Absolutely. Well, thank you. And really great to hear just so many tools in the toolbox. So we appreciate you diving into all of it. So thank you once again, Dr. Neff and Dr. Lent, for your time this evening. Such great information was shared. I know I learned a lot. And a huge thank you to our audience members for attending and submitting such great questions. It was a terrific discussion. We will be posting an event survey so you can let us know your thoughts, any other specialties you would like to hear from. If you would like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please go ahead and fill out the last question in the event survey. Be sure to visit jeffersonhealth.org to make an appointment, stay up to date on upcoming events and webinars, just like this one and more. You can also visit jeffersonhealth.org/livingwell for more health content, patient stories, research, innovation, and more. Be sure to also visit the Jefferson Health YouTube page to view more wellness webinar series events. We have various topics from back pain to robotic surgery to many others. And a recording of this event will also be sent to you so you can rewatch at your convenience. If there is anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful evening. Goodbye.